Oops, you don't actually have cancer, an article from the portal Chromola. After decades of cancer misdiagnosis followed by treatments and millions of crippled healthy people, the National Cancer Institute and the influential medical science journal JAMA have admitted they were wrong all along. Back in 2012, the National Cancer Institute assembled a panel of experts to re-evaluate the classification of some of the most commonly diagnosed cancers and their subsequent overdiagnosis and over-aggressive treatment of these conditions. They determined that probably 1 million people had been misdiagnosed with breast cancer, prostate cancer, thyroid cancer, and lung cancer, when in fact their conditions were safe and should have been defined as benign masses of epithelial entheology. No apology was made. The mainstream media completely ignored it, but the most important thing was not done either. No radical change in the traditional practice of cancer diagnosis, prevention, and treatment was made. So millions of people in the US and around the world who were convinced they had the deadly disease cancer and who underwent violent and crippling treatments for it were like hearing, "Oh, we were wrong. You didn't really have cancer." If you look at the problem just in terms of overdiagnosis and overtreatment of breast cancer in the United States over the last 30 years, the approximate number of women affected is 1.3 million. Most of these women don't even realize they have been victimized, and many of them treat their aggressors in a Stockholm Syndrome type of way because they think their lives have been saved by unnecessary treatment. In reality, the side effects, both physical and psychological, have almost certainly greatly reduced their quality and length of life. When the National Cancer Institute report was made, those who have long advocated the position that frequently diagnosed early breast cancer, known as encapsulating carcinoma of the milk duct, was never inherently malignant and therefore should not have been treated with lumpectomy, mastectomy, radiation therapy, and chemotherapy, turned out to be right. Dr. SRG, founder of the greenmedinfo.com Medical Science Archive project, has been active in educating people about overdiagnosis and overtreatment for several years. 2 years ago, he wrote an article, "The Thyroid Epidemic is Caused by Misinformation, Not Cancer," which he substantiated by collecting many studies from different countries that showed that the rapid increase in thyroid cancer diagnosis is due to misclassification and misdiagnosis. Other studies reflected the same pattern in the diagnosis of breast and prostate cancer and even some forms of ovarian cancer. It should be understood that the standard treatment for these diagnoses was removal of the organ, as well as radiation and chemotherapy. The latter two are strong carcinogens, leading to malignization of these innocuous conditions and secondary cancers. And as is usually the case with studies that contradict established standards of care, these studies also failed to make it into the mainstream media. Finally, thanks to the efforts of many honest oncologists, one of the most commonly diagnosed forms of cancer has been reclassified as a benign condition. We are talking about the popular thyroid cancer. There is now no excuse for those oncologists who suggest that patients treat these inherently harmless compensatory changes with total resection of the thyroid gland followed by radioactive iodine, putting the patient on synthetic hormones for life and constant treatment of associated symptoms. For the millions treated for thyroid cancer, this information came late, but many will be spared unnecessary suffering and a reduced quality of life due to crippling treatment. Unfortunately, this event did not become a media sensation, which means that thousands more will suffer inertia until official medicine responds. Oops, it turns out it wasn't cancer at all. Recognizes the National Cancer Institute in the American Medical Association's journal JAMA on April 12, 2016, in an article titled "It's Not Cancer. Doctors have reclassified thyroid cancer." The New York Times Magazine pointed to new research published in JAMA Oncology that should forever change how we categorize, diagnose, and treat a common form of thyroid cancer. An international group of doctors decided that the TRUCA, which has always been classified as cancer, turned out not to be cancer at all. The result was an official change in classification and condition towards benign. This way, thousands of people can avoid thyroid removal, radioactive iodine treatment, lifelong use of synthesized hormones, and regular checkups. All of this was with the goal of protecting against a tumor that was never dangerous. The findings of these experts and the data leading up to them were published April 14 in the journal JAMA Oncology. The changes are expected to affect more than 10,000 diagnosed thyroid cancer patients per year in the US alone. This development will be appreciated and celebrated by those who have pushed for the reclassification of other forms of cancer as well, including certain breast, prostate, and lung tumors. A reclassified tumor is a small mass in the thyroid gland that is completely surrounded by a capsule of fibrous tissue. Its core looks like cancer, but the cells of the mass do not extend beyond its capsule, and therefore surgery to remove the entire gland and subsequent treatment with radioactive iodine is unnecessary, and not crippling. This is the conclusion oncologists have drawn. They have now renamed this mass from an encapsulated follicular form of popular thyroid carcinoma outside the invasive follicular thyroid mass with features of a popular nucleus. The word carcinoma no longer appears. Many oncologists feel that this should have been done a long time ago. For many years, they fought to reclassify small breast, lung, and prostate masses and some other cancers and remove the name cancer from the diagnosis. The only reclassification before that was early-stage genitourinary cancers done in 1998 and early changes in the cervix and ovaries about 20 years ago. However, apart from thyroid specialists, no one else has ventured to do this since then. In fact, the opposite has been true, according to Otis Dor-Olai, Chief Medical Officer of the American Cancer Society. The changes have occurred in the opposite direction to the scientific evidence. For example, precancerous small breast masses became known as stage 0 cancer. Small and early prostate masses became cancerous tumors. At the same time, modern examination techniques like ultrasound, CT scans, MRIs are finding more and more of these small cancers, especially small nodules in the thyroid gland. If it's not cancer, so let's not call it cancer, says Dr. John C. Morris, president of the American Thyroid Association and professor of medicine at the Mayo Clinic. Dr. Barnett S. Kramer, director of cancer prevention at the National Cancer Institute, said, "We are increasingly concerned that the terms we use are not consistent with our understanding of cancer biology." He goes on to say calling masses cancerous tumors when they are not leads to unnecessary and traumatic treatment. The article goes on to say that while some specialty medical centers are beginning to treat encapsulated thyroid masses less aggressively, this is still not the norm in other medical centers. Unfortunately, there is a pattern emerging that usually takes about 10 years for scientific evidence to be reflected in practicing medicine, so medicine is far less science-based than it claims to be. Clearly, the truth about the real causes of cancer, as well as the truth about the myths propagated by the oncology industry, is beginning to trickle down even to the medical establishment like JAMA and even the MOS media, which usually plays a huge role in spreading misinformation on this topic. Despite this success, we need to keep working on this topic. Research and education must continue. In addition to the popular thyroid cancer, this is especially true for encapsulated ductal breast cancer, some prostate and lung cancer. When the reclassification of these conditions is achieved, it will entail a significant change in their treatment protocols. They will no longer be treated with organ excision, carcinogenic chemotherapy, and radiation therapy, meaning that millions of people will not receive staggering treatments that condemn them to constant suffering and dependence on official medicine, and many will be able to avoid secondary cancers caused by these treatments. Many will also avoid the process of malignancy caused by toxic treatments that destroy the body's defenses and turn a benign process into an aggressive malignant one. Imagine how many people around the world have already suffered and may still suffer, if only in the United States and only for breast cancer. It is 1.3 million women. Now, it should be obvious to everyone where official oncology gets such optimistic statistics, where it cures more than 50% of patients with cancer. Most of them did not have a correctly diagnosed cancer. and if these patients survived treatment, they became officially cured of cancer. At the same time, if many developed secondary cancers after 5 to 15 years, they were certainly never attributed to prior carcinogenic treatment. Many oncologists, and especially those who use the naturopathic concept of understanding and treating cancer, believe that symptomless cancer does not need to be treated at all, but only to make certain changes in one's lifestyle, diet, and thinking. One can, however, go further and quote Dr. Hardin Jones, a professor at the University of California at Berkeley, who claimed that according to his statistics of working with cancer patients over a 25-year period, those diagnosed with late-stage cancer who did not use the official triple therapy lived an average of 4 times longer than those who did receive such treatment. All this makes us take a new look at the situation with the diagnosis and treatment of this disease, and the fact that, unfortunately, today we cannot trust official medicine in this. If you liked the video, put a thumbs up and subscribe to the channel.